All right, let's get right into it. We're going to talk about a medication that I can almost guarantee is in millions of medicine cabinets, maybe even yours. It's the go-to fix for a, let's say, very common problem. But as we're about to find out, it has a serious secret that almost nobody knows about. You know the feeling, right? That sudden, urgent, drop everything right now feeling? You're desperate, so you reach for that familiar little box. And it works. It works fast. But the story of what's actually happening inside your body is way more complex and, honestly, a lot more serious than you'd think.
And look, let's be clear. This stuff is incredibly effective. There's no question about it. It gives you fast relief right when you need it most. But, and this is a huge but, that effectiveness comes with a major catch. A hidden risk that's so serious it prompted the highest possible level of warning from safety agencies.
So to really get a handle on the risk, we first have to understand why it works so well. Let's start with the basics, what loperamide is and what it's actually designed to do. Simply put, loperamide is an antidiarrheal. You can buy it over the counter, no prescription needed, and its whole purpose in life is to manage the symptoms of diarrhea. It's the active ingredient in a ton of brands you'd recognize in a heartbeat. And its approved uses are pretty specific. It's for things like a sudden case of traveler's diarrhea, for managing ongoing conditions like IBS-D, and even for some specific medical situations. So yeah, it's a totally legitimate and important medication. So how does it actually work? I mean, how does one little pill manage to bring your digestive system to what feels like a screeching halt? Well, the science behind it is pretty surprising.
Okay, here's the twist. Deep down, loperamide is what's called an opioid receptor agonist. Yep, you heard that right. It's chemically related to opioids. But, and this is the crucial part, it's designed to be a specialist. At the recommended dose, it's engineered to work only in your gut. It doesn't cross into your brain, so it won't cause any of the effects you associate with other opioids. Its action is totally localized, right where you need it.
So how does it pull this off? Just think of it like hitting the brakes on your intestines. First, it latches on to those opioid receptors in your intestinal wall. Second, that tells the muscles in there to just chill out. It slows down the contractions that are pushing everything through so quickly. And third, that slowdown gives your body more time to absorb water back out of your stool. And the end result is relief. Your gut transit slows down, your stool gets firmer, and you feel better. But the most important thing to remember here is that loperamide isn't a cure. It doesn't fix whatever's causing the problem. It just slams the brakes on the main symptom. And this is where the story takes a really sharp, really serious turn. Because what happens when someone takes far, far more than they're supposed to? The answer led to one of the FDA's most severe warnings. This is not a minor caution. A boxed warning or a black box warning is the most serious alert the FDA can issue. It's basically their skull and crossbones. It means a drug carries a major risk of severe or even life-threatening side effects. And in this case, the danger is aimed right at the heart. So why the heart? Well, at extremely high doses, loperamide can just overwhelm the body's natural defenses. It can get into the bloodstream in huge amounts, where it starts messing with the heart's electrical system. This can lead to dangerous, and sometimes deadly, irregular heart rhythms. This chart really puts it all into perspective. Just look at that difference. The safe, over-the-counter dose is capped at 8 milligrams per day. The kind of misuse that leads to these heart problems involves doses that are, well, they're astronomical. This isn't about accidentally taking one extra pill. We're talking about a completely different reality of consumption. And there's another risk, one that's actually more common. Remember how loperamide slows everything down? Well, if you have a nasty bacterial infection like salmonella, your body is trying to flush it out for a reason. Taking loperamide in that case is like locking the fire escape during a fire. You're just trapping the bad guys inside, which can make you sicker for even longer. So, the big question is, how do you use this powerful tool safely? It really all comes down to knowing the rules and respecting the limits of the medication. If you remember just one thing from all of this, let it be this number, 8 milligrams. That is the absolute maximum recommended dose for over-the-counter use in a 24-hour period. Never, ever go over that unless a doctor specifically tells you to. And it's just as important to know when not to use it. If you have a high fever or if there's blood in your stool, those are big red flags. It could be a serious infection where loperamide would actually be harmful. Same goes for having bad abdominal pain without diarrhea. It could be masking something else. When in doubt, just avoid it and talk to a doctor.
Okay, finally, let's talk about how to tell the difference between a normal, expected side effect and a true get help now medical emergency.
You can expect some mild side effects. I mean, the drug's job is to slow your gut, so constipation is the most common one. You might also feel a little bloated, maybe some nausea, or have a dry mouth. Generally, these are not a cause for alarm.
But these symptoms are different. These are red flags. We're talking fainting, severe dizziness, a heart that's beating way too fast or feels like it's fluttering. Those are signs of a very serious problem. If you experience any of these, you need to get medical help immediately.
And one last critical point on safety. Loperamide doesn't exist in a bubble. It can interact with other drugs. Some common medications, like certain antibiotics or antifungals, can actually increase its concentration in your blood. That raises the risk of serious side effects, even at a normal dose. This is why it is absolutely vital to tell your doctor or pharmacist about every single medicine you're taking.
You know, this quote from the source material really sums it all up perfectly. It is highly effective, and it is generally safe when you follow the rules. But it is not a benign drug. It's a powerful medication that you have to treat with respect. It's a tool, not a toy. It's designed for a specific job, and it has very clear limits. Knowing the difference between its intended use and its hidden dangers is what makes it a safe fix instead of a serious risk. So the question is, the next time you see that little box on the shelf, are you going to look at it the same way?